A critically ill woman was allegedly denied access to Vleyfontein Clinic. This is in Louis Trichardt in Limpopo yesterday. It's understood the woman was allegedly forced to wait for hours until the clinic opened at 7 a.m. Let's get the thoughts then of Limpopo Health MEC, Dr. Poppy Ramathuba. Always good to speak to Dr. Ramathuba. Doctor, good to have you on ENCA. Appreciate the time. Two things, not just as the Health MEC, but as a doctor, I imagine you're horrified to find out how this woman was treated. She ended up sleeping outside on the pavement. How angry are you?
Good afternoon, Gareth, and afternoon to all your viewers. Of course, the situation made me to be angry. But what I can indicate is that last night, when I received a call from community, it was around 7 o'clock, that there is a member of community who is seeking help, who has not been denied. The first thing we have to do is to make sure that the life of the woman is safe. Hence, an ambulance dispatched immediately to go and pick up the patient to be taken to Elim Hospital, which is less than 10 kilometers. And the patient has been attended to, and I'm comfortable now. We've just communicated with the patient. She's fair, she's been stabilized, her life has been saved. So the first thing that we needed to do was done. The second thing was to say the first thing in the morning, one had to visit the facility because, of course, I was not happy with the behavior, starting with the men in blue, the security men at the gate, who were given the instruction by the nurses not to open the clinic, and also those who were involved in terms of the nurses who have refused to attend to her. What I can reassure the public is that the matter has received serious attention from my office, and also from all administrators. The district executive manager is already at the clinic, and we would appreciate if the public can allow us as a department an opportunity to make sure that consequence management kicks in, because if we can jump into pronouncing whatever is currently happening, my experience is that we end up losing a lot of cases out of technicalities, because when people go to labor court, they cite all that the MEC was playing into the media gallery. We don't want to do that. We're happy that the life of the patient is saved. We're happy that we have been able to meet the staff, and we've been able to deal with the whole case. We're happy that labor relations have kicked in, and heads will roll. That I can reassure.
It's good to hear that heads are going to roll. MEC, help me understand what's going to happen at this clinic tonight in Vleyfontein as we look at the photos from outside the gates from someone who was on the ground. What's going to happen at this clinic tonight if someone else arrives there that needs urgent medical care? How is it going to be different to last night?
The clinic it's functional, it's working. As I've indicated, I've met with the clinic manager and the entire staff that is there. What we also did was to augment the staff by requesting those who were off duty to come in and assist, so that while we are dealing with the cases of those who are involved, the clinic continue to run. All the staff reassured me. They did apologize, even those that were not involved, but they did acknowledge and they did appreciate. We are in a Women's Month, for goodness sake, and you have fellow women. This is what is very painful, is that the people who have denied access to healthcare to a woman, it's fellow women like me. And I think that becomes unacceptable to say it really defeats the purpose that we should be the first one who have got empathy, who put ourselves in the shoes of the next person, for us to be able to deal with. But like I've indicated, one wouldn't want to get into the merit of this particular incident and say, let me allow the administrative processes to kick in like it has already started, so that we can be able to go back and say, if you do wrong, consequences management does apply in the Department of Health.
I think many people would appreciate that there are processes to follow, MEC. I don't think anyone would argue about that. I would like to know, though, are the security guards and the nurses who were on duty during this incident last night, are they going to be on duty tonight? I can't imagine the community will be happy with that if they are. Are they working tonight?
As I've indicated to you that maybe I've given you a hint to say, even those who were off duty have been requested to come and assist. So that must tell you what is currently happening. What the community must appreciate is that the clinic is going to function. They are going to be attended to. If it means I must come and work with my administrators, those who are clinicians will come and do and work. But what I'm just emphasizing the fact that the clinic is not going to close. The clinic is going to work, and we are going to have the staff that is going to attend to the public. The issue, Gareth, is that I'm very passionate when it comes to clinic services because I'm always saying our hospitals are overcrowded. The nurses and doctors in the hospitals cannot cope because patients bypass clinics and go to the hospital. Now, when the patient starts at the clinic to seek help, and the very same clinics do not want to attend to them, we are defeating the purpose. I'm the one who is saying to the public, please don't overcrowd the hospital. The reason we have built clinic on your gate is to make sure that you have access to quality health. Access to quality health care is not the building. It's when the people are able to get into the clinic in whatever condition, the clinic must be able to attend to them. If the clinic believe that this case is above their scope, they can call an ambulance. If they're struggling with the ambulance, I was sharing with the nurses, I'm here for that purpose. It would have been better if one of you had called me to say, MEC, we've got this particular case, we're struggling to get an ambulance, can you intervene? Which happens on a daily basis, and I always intervene. But this time around, people just deny an innocent woman access to health care. And that, of course, it has made not only the community angry, even myself, and I'm sure even yourself and everybody else who could come across this story incident will not be happy.
No, certainly not. I'm glad to hear that heads are going to roll as well, while certainly appreciating there are procedures to follow, but glad to hear that from the MEC, Dr. Phophi Ramathuba, Health MEC, joining us here on All Angles. Of course, we'll follow up with that as well, but it looks like there is going to be swift action taken. Heads are going to roll. Those are the words from the Health MEC.